Well, what we're trying to learn from this too is that, we know the individual toxicities of a lot of these chemicals. I've treated lots of, for example, arsenic cases. I've treated a lot of lead cases. I've treated a lot of patients with different types of specific chemicals. There's fairly little literature on specific toxicity from fly ash, for example. We know from previous accidents that it has not created a lot of major problems, but again, there's only so many accidents that occur per year, and if we collect the data at the time, we can at least get a better baseline. Well, I don't think there's been a truly focused evaluation of fly ash with people in the past. They've obviously had disasters. The presumed thought was that it didn't cause any major problems. The people that were examined and tested for it, appeared and looked okay in the short term and in the long term. But again, there are very small numbers that have been involved in that. And so we're hoping to expand on that field with a little bit more focused, specifically looking at the real risk from a toxicologic perspective. There's multiple sources right now. One of them is obviously to use, starting from the local and going up to the national, federal level. They can always start with the Poison Center. That's where the 3 toxicologists in Tennessee work. That's what we deal with, and they can always call and get, the most current information that's available. They can always call, Tennessee Department of Health, for example, or even the local health department. Going more to our more national level, we have the different federal agencies, specifically CDC and ATSDR from a health perspective. Well, in general, what we've seen in the limited medical literature out there is that it's a relatively non-toxic type of material. We know that the particular measurements already obtained, that the levels are actually pretty far down, and that even eating a certain amount, I'm not recommending this to anybody, but if they're eating a certain amount of fly ash, even per day, even for a little kid over a long period of time, they would not get to anywhere where we know that there's a problem with some of these particular chemicals. So even though, for example, arsenic was already high, even eating some of it on purpose per se is not going to give you enough of an arsenic level to cause a problem if conditions stay the same. The problem then becomes if it starts accumulating in specific water wells or that type of thing, then it could change the parameters under which those measurements were obtained, and then we may find that it could cause a problem. Hence the other reason for doing a baseline evaluation and then doing periodic evaluation to make sure nothing's happening. We basically try to get everybody that was potentially exposed, to be assessed. We do, however, want to tailor it to what is the risk at hand, and that's where it always differs. There's a specific population, geography that's involved in the situation as to who can get exposed, the particular substance and how it can potentially get into the person. So because of that, it's going to affect, or the potential for affecting people is different than what would happen if it were just in a building and it's only an airborne type of exposure as opposed to these other routes. There was a long list of chemicals that basically EPA, Department of Health, etc. have been testing. We first looked at the list to see of those different chemicals or elements that are out there, which ones are a potential human risk. Based on that, then we looked, okay, based on what's there and has some potential for human risk, how can we really assess them, measure them, and look at them, and therefore then we could narrow the list even further. And then the next question was, what is the best way to measure that particular chemical? Because sometimes you can actually measure the chemical, but sometimes the best evaluation is not to measure it, but to measure the effects on a particular organ or system. So it's an indirect measurement, if you will. Well, I would say that we're here to help you. All I can do is offer. If you don't want it, you don't want it. That's your call. But I think we have something to offer. We can screen, look to see if there's any potential problem. If there is one, we'll find it, let you know what you need to do at that point, or what I will need to do at some point if necessary, or even give them recommendations of what they need to do with their own family doc. Well, and I think some people have already seen the family physician. The problem that happens there is, again, the background of most physicians, and I'm not talking about just the family medicine, but it could be essentially any specialty, is that they don't have any really training in toxicology. So trying to put together some symptoms, some historical findings, getting the depth of history that's needed, as well as the specific signs and symptoms that we're looking for during our history and physical session, they may not obtain everything that's needed at that point.